Hello, good evening. Hello, good evening, everyone. This, there. We're just fixing some technical issues. Hello, there.
Hello?
Hello, Doc. Yeah,
Hello?
there you go. Hello, Doc. Is it clear?
Hello, yes. Okay na?
Ayan, okay na,
Yes, I
Doc.
think so.
Ayan, perfect. Good evening, everyone. This is Jasper Alfred Alana, a registered nurse and currently taking up my master's degree in health informatics at the University of the Philippines, Manila, College of Medicine. I'm also the founder of eHealth X Solutions, a health and internet company involved in emerging technologies on healthcare. So now I would like to welcome you all to our MSI webinar tonight. The topic for tonight is the history, benefits, and challenges of implementing a health information system, a hospital information system. Our guest speaker for tonight is Dr. Jose Jasper Andal from St. Luke's Medical Center. Good evening, Doctor.
Hi, good evening, everyone.
Yes, so this webinar will run using GoToWebinar. And if you are experiencing any problems, please log out of the session and rejoin the room using the links sent via email or entering the GoToWebinar ID 484-658-427. Also, please note that your mic should be mute for the duration of the webinar. Also, the question box for questions and comments are available on the right side of your GoToWebinar. This session will run for about an hour with 30 minutes allotted for the lecture and followed by the reaction and question and answer portion. So may we also remind all the participants to fill the following for your certificate of participation. So we have the evaluation form under the bit.ly HIS eval and the post test bit.ly HIS post test. So the topic for tonight is the history, benefits, and challenges of implementing a hospital information system. The objectives of this webinar are to understand and define a hospital information system, cite common functions of the HIS, describe benefits of an electronic HIS, and understand challenges in the HIS implementation. Our guest speaker for tonight is Dr. Jose Jasper L. Andal. Dr. Jasper is a board-certified anatomic and clinical pathologist since 2011 with special interest in molecular diagnostic pathology, orthopedic pathology, and quality assurance in the clinical laboratory. He is the molecular pathologist quality assurance officer at St. Luke's Medical Center and is a consultant pathologist at Philippine Orthopedic Center. He graduated Doctor of Medicine from University of Santo Tomas in 2004 and pursued his MS Molecular Medicine at St. Luke's Medical Center. He also took his fellowship in molecular pathology at Columbia University Medical Center, specializing in personalized genomic medicine. He has been a speaker on various topics, such as pathology and diagnostics, in several national and regional conferences. He also co-authored a paper on clinical and histopathological profile of BRAF V600E, mutation in conventional papillary thyroid carcinoma in a Filipino population. Lastly, Dr. Jasper is also an active paddler of the Philippine Dragon Boat rowing team Fireblades. Let us all welcome Dr. Jasper Andal. Hello, Dr. Jasper. Good evening.
Hi, good evening again.
Good evening, Doc.
Let's start with a brief introduction into this topic. I myself, I'm actually sort of trained more in pathology, and I sort of got into this field of informatics via my work as quality assurance officer in the laboratory. So implementing sort of part of the health information system, specifically that of a laboratory information system, needs coordination with the end user. And from my end, the end user will be someone from the laboratory. And then gradually I got pulled into some of the other aspects of the HIS into the hospital, sort of to coordinate some of the other departments' functions in terms of implementing an HIS. So with that said, let's go to the next slide. Okay, so these are just some of the objectives that I sort of planned for this evening. I'd like to begin with what we want to achieve for this evening, mainly to understand and define what a hospital information system is and what are its functions. Um, we'll focus more on the common functions of an HIS and also to describe the benefits of an electronic HIS, and then lastly to understand some challenges in the implementation of or hospital information system specifically. If we still have time, I'd like to start with
Hello. Your the line is not clear, Doc Jasper.
oh,
Yeah, there.
next
Sorry.
slide, please. How about now?
This is better, Doc.
Okay, next slide. Okay, so let's define what is a hospital information system. And basically, it's an information system. It's designed to support a hospital in defining what are its best practices, how efficiently it can run, both in the administration of its services to patients, also to internal clients, not just patients. A hospital does have both external and internal clients. So, in terms of coordinating activities, we'll see these functions later on. So, right off the bat, also want to sort of delineate the differences between a hospital information system and a health information system. Um, the distinction between the two is that a health information system is more defined as sort of a greater scale in terms of a nationwide database. As you may think of it, sort of in our setting, it would be managed by the Department of Health. So it has a greater scale, and the hospital information system will be more on focus within the institution itself. So I hope my line is still clear.
Yes,
And
Doc. It's very clear.
let's go to the next slide, please. Okay. So the understanding of how an HIS or a hospital information system functions will require us to sort of have a big picture view of how the hospital itself functions, right? So classically, we may think of hospital um, dispersing its function basically to a patient. The classic uh, concept that we have is that a doctor takes care of a patient, patient gets well and goes home. So, but we do have a lot of myriad other functions happening in the background supporting that basic function of taking care of these patients. So we do know that the patient, for example, uh, may initially go to in a hospital through the emergency room, gets assessed by a doctor. The doctor gives the orders, and it may be for some laboratory tests. It may be for some X-ray studies, for a CT scan or MRI, and depending on the diagnoses, a patient may be given medications from the pharmacy. Additional orders may be carried out by the nurses. If the patient has to be admitted into the hospital, the patient goes inside a room. So that's sort of the basic flow of how a patient gets inside the hospital. There are a lot of other functions that happen in the sidelines that may not be visible to the patient. Um, for example, a system has to be in place for a doctor's orders to be carried to the pharmacy, for the medications to be given to the patient. That's one, for the coordination between the doctor and the pharmacy. And then a system has to be in place within the laboratory and between the laboratory and the nurses, for example, for the doctor's orders for a blood test to be carried out to the laboratory and for someone in the laboratory to send someone over to take the blood. And once the blood test results are available, the results have to be transmitted to the emergency room or the patient's ward or the nurse's station. So all of these parallel functions, parallel systems are happening at the same time. At the background, again, you have other functions of the hospital. For example, if a patient gets admitted, uh, for example, a patient has to eat, right? So it's important for the hospital food to be available to the patient. And has the dietary department has to have a good inventory and a supply management chain to guarantee a steady supply of food. For the room to be clean, it has to be uh, managed efficiently by a facility management system, coordinating with the engineering of that building and the housekeeping departments. And all of the subsequent orders of the doctor has to be carried out by the nurses. All the patient's orders are classically inputted into the patient's chart. It can be a paper-based chart. It can be an electronic chart, and all the staff of the hospital has to be managed by the administration, has to be managed by human resources, and the patient eventually has to pay, right? So the billing, the records, and the reimbursement have to be managed perfectly for the business side of the hospital to function. So it may appear complicated, but all of these functions are necessary at the least for a hospital to to provide these services to a patient. So going back to our definition of an HIS is an information system that supports the efficient hospital administrative activities. And all of these activities that we mentioned are happening around the patient. And all of these activities are sources of information that have to be managed and to be more efficient. For example, again, if you look into the pharmacy, a proper requisition system, a proper inventory system has to be in place in the pharmacy to guarantee that the medications are always available. Which medications are fast moving, which medications are running out of in the stocks, so that has to be in place. For example, my work is primarily in the laboratory. So in the lab, we have to have a system in place where we can readily receive the requests from the doctors, and once the results are out, we can rapidly transmit those results, especially if they're critical. So those a laboratory information system has to be in place. Again, these functions have to be monitored at a big scale, at a big picture view, and to gather all of the information, for example, for a month, for a year, and to look at that data and analyze that data to support an efficient system for the whole hospital. So that's how we can sort of apply the definition of an HIS into the functions of a hospital. So let's go to the next slide. So we can also define an HIS depending on who you're asking in the hospital, really. If you're asking a clinical physician, a clinical doctor, um, his or her perspective of an HIS may be simply the patient's chart, a patient's medical records. If you ask someone in the supply department, it can be simply uh, an item inventory within that department. If you ask someone from my laboratory staff, it can simply be a system that is in place to facilitate lab test ordering and charging. If you ask someone from the administrative personnel, it can be a system in place to handle the financial and fiscal aspects of the hospital. So again, within a department, within different departments of the hospital, you can have sort of a mini system in place that's aligned with the whole hospital information system. Okay, next slide, please. Okay, so to give us a different perspective, if you look at the publications of how they would describe their own hospital information system. The definitions and the structure of a hospital information system may vary from hospital to hospital, depending on what the hospital is trying to do.
Dr. Jasper? Oh.
Sorry, is my line still clear?
Yes, yes,
Hello?
doc. It's okay now. It's okay again. It's okay again.
Okay. So,
Yes.
yeah, so again, a hospital information system may vary from country to country, from hospital to hospital. And I think this is one of the better publications out there that sort of gives us a good structural overview of how they classify the components of a hospital information system. If you look at the topmost part of this this graphical representation, you have the clinical information system. That's part of their hospital information system. This is a paper that describes their system based in Korea, one of the bigger hospitals in Korea. So under that CIS, you have the EMR, or the electronic medical records. You have the PACS, or the picture archives system, which basically handles images that comes off from radiology, from the other imaging departments of the lab of the hospital. And you have the OCS, which basically means that this is a system that handles the physicians or the clinicians' orders. Now, supporting those functions, the HIS, you have a referral system between departments. You have a clinical research support system that sort of handles the data that comes off from clinical research. The administrative information system, again, handles the fiscal, financial aspects of the hospital, even includes the PMPA, which handles the personnel management. um, Also, you have a management information system, and I think this you have to have a very strong IT department to handle a big project like implementing an HIS. So this is a good paper you can go back and read up and on. It's a good paper that describes how HIS in Korea functions. There's not that many local, I think, papers that's based in the Philippines describing their own experience in terms of implementing an HIS. And that's a good publication that should come out of locally, at least, to describe how we do things in the Philippines, right? So if you go to the next slide, please. Okay, so let's step back and discuss something about the history of an HIS. So, and to discuss the history, we cannot but not discuss how an information system back then looks like. And unfortunately, for some hospitals still in the Philippines that are resource constrained, they may still be paper-based entirely, and they can still function perfectly. We do have this mental picture of a paper-based system being as inefficient, as cumbersome, as tedious, but a paper-based system in a small scale can still be considered as a hospital information system. If you go back to our basic definition of an HIS, right? So it's basically an information system. It still can be paper-based. We do have this connotation in our minds that an HIS, especially in a big hospital like St. Luke's, has to have an electronic or digital or computer-based system to handle that massive amount of data coming off from different departments simultaneously. So if you go back to our next slide. Okay, so I like this slide really because it sort of gives us two situations. One is a paper-based filing cabinet, very neatly stacked, right? It's clearly organized, has clear tabs, has clear demarcations, and you can rapidly get a file if you thumb through those tabs really efficiently. And to the right, you have a desktop. And I'm not sure if your desktop looks like this, but it's an example of how something digital is not always a solution. If you always have a human element to a digital system right now, right? So if your system in place is not implemented well, you could end up with a chaotic system like like the desktop you have to the right. So a digital system is not always a better alternative. So you have to be able to choose an HIS that would match or will be compatible with what you have in your setting. It has to be scalable, meaning you can sort of implement or buy a software that has a big capacity, a big scale, but you can't scale it down to what would be applicable to a smaller hospital setting. So that's one thing that you should really remember in choosing an HIS. It has to sort of match what you have inside your hospital right now. Okay. So let's go to the next slide, please. Okay, so the history of the HIS, and this is when we're talking about HIS at this point, we're talking about an electronic HIS. In the 1960s, in the US at least, this is the time when the large hospital systems began to acquire big computers. And back then, they were more expensive, they're more cumbersome, they're not easily deployed, right? Like unlike right now. Um, Forward to the 1970s, smaller scale computers, lower cost computers enabled the placement of these terminals in various departments of the hospital, for example, in the nursing stations. If you go to the next slide, to the 1980s, sorry, back to 1960s, 70s, um, one other thing that happened during these decades is that the US government started funding academic centers like the one in Colombia, where meaning they developed their own system. And then eventually, software vendors acquired and marketed some of the successful academic prototypes that were developed in those centers. And by the 1980s, local area networks um, enabled the coordination from between the different departments of the hospital, and also smaller scale computers enabled the deployment of these to various departments of the hospital, including bedside terminals. So that development, both um, technological wise in terms of how the technology developed later on, sort of followed the development of the HIS. So let's go to the next slide, please. Okay, so by the mid 1990s, the federal funding, meaning the funding from the US government, sort of diminished. But at the same time, the commercial vendors sort of upped their game and developed more commercial systems that they were selling to the hospitals this time. Um, and one of the key things that has to be set in place for these different software packages by the vendors is that they have to be compatible with different operations. This interoperability became a main design requirement for HIS. Now, more recently, again,
You're
open
having
system architectures and interconnection
there.
standards. Hello, hello. Is this better?
Hello, Doc. Yes, you got
Hello.
disconnected a while ago.
Yes.
Okay.
Oh, okay. Um. So yeah. So I
You
think
were talking
I
about
hope.
beyond 2010?
Okay. There we go.
Yes.
Beyond 2010, what happened was the developers, the private commercial vendors, were developing software packages that were designed to be open and were compatible with different systems. And this was designed sort of to meet the need of the users of the hospitals that had different existing systems on hand. Meaning, for example, the radiology department had their own system going on, the laboratory had their own software package going on, and now those two systems have to talk at some point have to have a common language. So what was being developed was a system that would enable these other systems to communicate, sort of a middleware, or a more open system that would not require middleware, that would be compatible for these existing systems on hand. Okay, so let's go to the next slide, please. Okay, so let's go to the benefits of implementing an HIS. So again, if we live in an ideal setup, if we live in a utopia and you're setting up an HIS, this would be like the ideal. You have a new hospital, a new system, and a new set of personnel that all of them are computer literate. Um, you don't have existing systems that you have to worry about compatibility. Everything's from scratch. You have a system that can cover the whole hospital, and you can dictate the scale of that system. You can dictate how the system, the system that you will in place will be very efficient. So, but I haven't heard of a hospital that's built like this. So at least from what's our experience locally, what we have locally, if you go to the next slide, is that we have an existing hospital system, and you're going to sort of uh, choose a software that would sort of fit your existing system. And one of the problems is that you have to customize that system, that software, to sort of uh, meet your needs, the needs of your hospital, the needs of your laboratory. And that's not always the case. It's not always a possibility. So sometimes you just have to change your own workflow because of the limitations of the software options out there. Okay, so with that said, the benefits are more myriad than are more numerous really than the disadvantages. So the benefits of an HIS is that you have at your fingertips evidence-based big data medicine. You can make decisions from from an administrative point of view to make decisions in terms of what to procure, what to offer, what to buy for your hospital, how much you have left in your coffers. Another benefit is that you have increased efficiency in management, both in clinical and administrative, in terms of the information that you have ready for your patient are readily accessible. So the more obvious benefits are, of course, versus paper-based systems and clerical errors, you have less errors and increased patient safety if you have an electronic hospital information system. So if you go to the next slide. Oh, did we skip? Okay, so let's go to the challenges in HIS implementation. So we do have some challenges to think of in terms of um, implementing a system for a hospital. First off is you have to convince your administration to sort of support your decision to buy the software, to buy the hardware to support your HIS, right? Am I still clear?
Yes, Doc. You're still clear.
Hello? Okay,
Yes, Doc.
I'll just find the sweet spot. Okay, so in terms of, I sort of stepped out of my Uber right now. So,
Okay.
here we go. I hope I'm
It's getting
clear.
choppy now, Doc.
Hello?
Hello, yes. It may,
Hello?
maybe,
Oh, okay.
yes.
Wait a minute. Let's find. Is this better?
Yes, this
It's
is
better?
better, Doc. Yes.
It's clear now, I hope.
It's clear, Doc. Yes, it's clear. This is better.
Okay, okay, okay. So, um, some of the other things that you have to factor in are the logistics. Once you've convinced your bosses that you have to procure an HIS, so you have to think of which software and hardware options to consider, and then think of your personnel. Are your personnel receptive to this change? Will your personnel be computer literate and software literate enough to embrace the changes that you're implementing in terms of your information system? So you have to sort of survey your own people and see if this is feasible. Because at the end of the day, if you don't have support from your staff, you have to really look at the feasibility of implementing this with probably new hires, or you have to hire new people on board and to implement an HIS. Okay, next slide, please. Okay, our other challenges is that, again, you have to look at the compatibility with existing systems. We mentioned this a while back, that some of the challenges that we encountered are that of compatibility. Compatibility with what your current workflow is, for example. Um, Upon implementing an HIS, some of the things that you might discover is that your existing workflow may be flawed. So do you change your workflow? Do you see this as an avenue to improve your workflow, but you have to reorient all your people? Or do you ask your software to be customized to fit your sort of flawed workflow? Also, you have to look into the um, options of procuring middleware. Now, who would develop that middleware? Would it be the vendor that sold you the HIS package? Will it be an in-house developed middleware? Or so these are some of the practical things that you have to look into that usually come out only upon implementation. Some of the things that you have to consider in choosing a system, a software package, is that you have to have good after-sales support. So generally, these software packages are in the range of millions of pesos, and you have to have a good after-sales support to sort of support your hospital's functions. Remember, your hospital is not functioning during office hours only. It's a 24/7 operation. So you have to have vendor support that's available on a 24/7 basis as well. Some other practical stuff is that you have to look into minimal work disruption during deployment of the system. Again, your patients will not really care much for any excuse in terms of um, potentially fatal errors um, in terms of their own patient care. So you have to have minimal work disruption when you're actually in terms of deploying that HIS. Okay, let's go to the next slide. Okay, these are some of the other concerns that have come up. Some of the more challenging things, I think, locally is that of patient privacy and data confidentiality. And I've chosen this landmark um, settlement that happened in the US only recently in 2016. It's a $5.5 million fine to an advocate health company. Basically, what happened is that 4 laptops that contained confidential patient health information, or PHI, and all of that information was unencrypted. It got out, and the patient data got out, affecting millions of patients. So, do we have this system, at least locally, that would guarantee patient confidentiality when your system is handling so much patient data? Unfortunately, um, the the law that's enacted in the US, the HIPAA law, is very stringent, but unfortunately, the local counterpart for data privacy here in the Philippines, at least, has not been fully implemented. So this may become a big issue in terms of how we secure confidential patient data. How do we secure this amount of data, this sensitive information for our patients? So next slide, please. So what are the future trends for the HIS? And I hope we still have time. What's next for HIS?
Yes, Doc, we still have time. Yes.
Okay. Um, this is a particular topic of interest for me because I do work partly also with molecular pathology diagnostics. And one of the trends right now, at least in the West, is that you have an influx of patient data that has incorporated genomic data or genetic data from the patients. This means the patient, for example, may have in their health records, whether it's a paper-based medical chart or an electronic health record, that data may contain genetic data on the patient, meaning predisposition to diseases, risk for transmitting diseases to their offspring. So these are genetic or genomic data that can be incorporated into the patient's charts. Now, this has the potential also to improve patient care. For example, we may have genetic data on a patient regarding his or her susceptibility to certain drugs or their sensitivity to certain drugs. For example, if the patient is a known allergic to a certain drug or a certain antibiotic, and that data is already in the system, those safety measures may come into play when to prevent any administration of that drug that may be harmful to the patient. So in that sense, it's really useful. But again, if you're not secure with how you handle data in your hospital, sensitive information may come out of and may be able to and can potentially be open to liability or genetic discrimination for the patient. So these are some of the interesting things that are happening more in the West recently than from our side. So next slide, please. Hello.
Hello? Yes, Doc.
Hello.
Doc Jasper? Hello? Doc Jasper?
Am I still clear?
Yes,
Okay.
Doc. You're
Next slide, please.
the I already changed it to the HIS customer feedback.
Oh, I think I have a bit of a lag on from my end. So
Okay.
yeah, but one of the other thing that we have to consider is that of customer satisfaction. Okay, here we go. I got my slide now. So
Okay.
one of the things that is a critical component of quality assurance in managing a hospital is customer feedback or customer satisfaction. And this is a big part of how you manage and market your hospital right now. There is an added benefit of your hospital being on social media. It's free, basically free marketing. For example, you have Cleveland Clinic here, an example of a big medical system in the US that's active in its social media accounts. But if you look at, for example, the social media account of St. Luke's, there are a lot of complaints posted on that website. So you have to have a 24/7 staff ready to answer those queries, comments as well, and have to manage any troll accounts that may hack your system. So before you venture into this aspect of promoting your hospital, you have to look at all the other things that you have to be in place to sort of check the perception of the public for your hospital. But the good thing though is that it's a continuous feedback mechanism, a very cost efficient feedback mechanism for your hospital that actually has to be in place, and all of the input, whether it's negative or positive for your hospital, has to be considered, and it's a good source of information and feedback for the improvement of your hospital. But again, you have to have a good marketing and a dedicated social media department to handle that account. Okay, so I think this is one of my last few slides. Next slide, please. Yeah, I think there's a bit of a delay from my end.
It's okay, Doc. It's already in the suggested reading.
Okay, so
Yes.
this is a good article that I found. It gives us a perspective of how a group of a multidisciplinary group in a hospital uh, looked into how their patient information system from their side was able to come up with a different perspective of how they sort of implement and evaluate how efficient their system is. So it's a good read. It's a good perspective on this on the hospital information systems in general. So I think with that, I'd like to thank you for your kind attention, and I think we are have to open the floor for some questions, I hope.
Yes, Doc. Thank you very much for that lecture. It's very there are some questions from the panel, Doc
Sure.
Jasper, and I'll read the first one. Hi, Doc. In your own practice, how has HIS improved your workflow or processes? Can you give specific samples?
Okay. So one solid example, and this is fresh from my laboratory experience, is that I was sort of organizing how the departments of our laboratory were reporting their performance indicators, meaning these are indicators of the number of samples that they process, the number of potential errors encountered, the number of patient complaints encountered, the number of quality control checks that were not made. So all of this has to be were being done manually. It's a very tedious process, right? So you have to have a good paper trail for each parameter, um, and there's a lot of parameters that has to be reported for each department in the laboratory. Um, when we procured a laboratory information system, it, it gave us a good way of sort of doing this in a digital electronic format. So all of these indicators are placed inside the system almost real time as they happen. So at the end of the day, all of these parameters gets checked, and at the end of the month, all of these parameters are summarized, and it gives us a good graphical representation of how far along or how far worse or better we are doing compared to the months before. So it's a good way of using technology to sort of help us operate the laboratory in a more efficient, in a more dynamic, in a more responsive manner. I hope that sort of gives you a good idea of how we can sort of leverage all this the software available out there to help us manage our departments in the hospital.
Okay. Then we still have two more questions, Doc Jasper. The
Sure.
second one is in your opinion, with the status quo, how long would it take for the Philippines to implement HIS to all hospitals, especially the public ones, or if not all, maybe 90% or majority?
Hello. I'm sort of losing you.
Oh, sorry. I'll repeat the question, Doc. In your opinion, with the status quo, how long would it take for the Philippines to implement
Okay.
HIS?
Your question, if I got it right, was in terms of. Sure. Sure. Please.
Yes. On how long it would take for the Philippines to implement HIS to all hospitals, especially the public ones. Are we still like a long way to go, or
So I think we have to sort of break down the question in the context of private hospitals and public
yes?
hospitals, government-owned and managed hospitals. For the private hospital setting, um, most of the large tertiary hospitals have some form of an HIS.
Okay.
Okay, so there are, especially the big ones like Medical City, Makati Medical Center, St. Luke's. These are the big hospitals that have an HIS in place. Again, it's sort of a compartmentalized within these hospitals. Each department has their own thing going on, but an HIS is in place at least at different scales at these centers. For the smaller private hospitals, that would be a problem in terms of logistics. Some of these hospitals may not see the need if if their vision for their center is to sort of maintain their own um, operations at the scale that they're going at. For example, if you have a tertiary or a secondary small 100 or 50 bed capacity hospital, they may actually not see the need for an electronic HIS. So it's hard to sort of predict where they might go. In terms of public hospitals, though, the Department of Health um, has actually been in talks with software providers for deploying hospital information systems within the DOH routine hospitals. I'm also affiliated with the Philippine Orthopedic Center, and we've had initial talks about doing an HIS in our hospital. In terms of projecting how this will come into play in the majority of hospitals, my best rough estimate, I guess, would be in about 10 to 20 years. And that's at best a guesstimate at this point.
Okay, thank you for that, Doc. The last question we have is that um, in terms of human resources, do you think it's better to, number one, train medical personnel in learning information technology systems, or train IT personnel to learn about the medical or healthcare needs of the hospital or clinic?
Okay, this is actually a very, very good practical question.
Yes, Doc.
And from my experience, I think you have to have a team. You have
Team.
to have someone from the IT department and have them study how a hospital functions. And at the other end of the spectrum, you have to have someone from the different departments to sort of specialize and study how these information systems work. And only when you have this sort of multidisciplinary team working closely together, that's, I think, the best scenario moving forward in implementing an HIS. If you have someone from the outside, like an outside vendor, you can hire someone to look into your system. It's different. It's difficult. They may not know the intricacies of the system, so it may take a longer time for that outsider to sort of get a hold of how your system works and how to best customize a software package for your system. So it has to really be a good multidisciplinary team working to develop this for your hospital.
All right. So I think that's all the time we have for this evening. And again, Dr. Jasper, I would like to thank you for your time
Oh, thank you for having me.
in having this webinar with us. And I'm sure all the attendees appreciate and learn something new. And thank you again for giving the lecture tonight, Dr.
Okay.
Jasper.
Thank you so much and good night.
Thank you. Good night, Dr. Jasper. Thank you. So that's all we have for this evening. Thank you very much for all the participants for attending. I would like to remind the evaluation form, you can access it at bit.ly HIS eval or and the post test form at bit.ly HIS post test. Thank you and good evening.